A 52-year-old male presents with left lower quadrant pain, low-grade fever, and leukocytosis. What is the most likely diagnosis? A. Appendicitis. B. Cholecystitis. C. Diverticulitis. D. Pancreatitis. Answer: C. Diverticulitis commonly presents with LLQ pain, fever, and elevated WBC count in middle-aged and older adults due to inflammation of colonic diverticula. Which of the following medications is the best initial treatment for acute gout? A. Allopurinol. B. Colchicine. C. Indomethacin. D. Febuxostat. Answer: C. NSAIDs like indomethacin are the first-line therapy for acute gout attacks due to their anti-inflammatory effects. Allopurinol is for chronic management. What is the most appropriate next step in evaluating a patient with suspected pulmonary embolism and a low Wells score? A. CT angiography. B. D-dimer test. C. V/Q scan. D. Start anticoagulation. Answer: B. A low Wells score indicates low PE probability, making a D-dimer the appropriate non-invasive and cost-effective next step to rule out PE. Which of the following is the hallmark finding of nephrotic syndrome? A. Hematuria. B. Oliguria. C. Elevated BUN. D. Proteinuria greater than 3.5 g/day. Answer: D. Massive proteinuria, greater than 3.5 g/day, is the defining characteristic of nephrotic syndrome, often accompanied by hypoalbuminemia and edema. A patient with known HIV presents with fever, cough, and a CD4 count of 180. Chest X-ray shows bilateral infiltrates. What is the most likely diagnosis? A. Histoplasmosis. B. Pneumocystis pneumonia. C. TB. D. Bacterial pneumonia. Answer: B. Pneumocystis jirovecii commonly infects patients with CD4 less than 200 and presents with diffuse infiltrates and respiratory symptoms. Which of the following cardiac findings is most associated with Marfan syndrome? A. Aortic dissection. B. Mitral stenosis. C. Tricuspid regurgitation. D. Ventricular septal defect. Answer: A. Marfan syndrome increases the risk for aortic root dilation and dissection due to connective tissue weakness, especially in younger patients. Which lab abnormality is most consistent with primary hyperparathyroidism? A. Low calcium, low phosphate. B. High calcium, low phosphate. C. High calcium, high phosphate. D. Low calcium, high phosphate. Answer: B. Elevated PTH in primary hyperparathyroidism causes calcium retention and phosphate excretion, resulting in high calcium and low phosphate. Which antibiotic is contraindicated in pregnancy due to risk of tooth discoloration and bone growth inhibition? A. Cephalexin. B. Azithromycin. C. Tetracycline. D. Amoxicillin. Answer: C. Tetracyclines cross the placenta and can affect fetal bone and teeth development, making them unsafe during pregnancy. A 65-year-old male with a history of smoking presents with hematuria but no pain. What is the most likely diagnosis? A. Kidney stone. B. Prostatitis. C. Bladder cancer. D. BPH. Answer: C. Painless hematuria in a smoker is highly suspicious for bladder cancer and should prompt further urologic evaluation. What is the most appropriate test to confirm Cushing's syndrome? A. Serum ACTH. B. 24-hour urinary free cortisol. C. MRI of pituitary. D. Low-dose dexamethasone suppression test. Answer: B. The 24-hour urinary free cortisol test is a reliable initial screening test for endogenous cortisol overproduction. Which vitamin deficiency causes bleeding, bruising, and prolonged PT? A. Vitamin B12. B. Vitamin D. C. Vitamin K. D. Vitamin E. Answer, C. Vitamin K is essential for clotting factor synthesis. Deficiency leads to coagulopathy with elevated PT/INR and bleeding. A 25-year-old presents with fever, sore throat, and posterior cervical lymphadenopathy. Monospot test is positive. What should be avoided? A. Acetaminophen. B. Amoxicillin. C. Ibuprofen. D. Oral steroids. Answer, B. Amoxicillin use in mono often leads to a pruritic rash due to hypersensitivity reaction, not a true allergy. What is the recommended initial screening for diabetes in adults? A. OGTT. B. Hemoglobin A1C. C. Random glucose. D. Fasting glucose. Answer, D. Fasting plasma glucose is an accessible, cost-effective, and standard method for initial diabetes screening. What is the most sensitive test for diagnosing hypothyroidism? A. T3. B. Free T4. C. TSH. D. TPO antibodies. Answer, C. TSH is the most sensitive marker for thyroid dysfunction and should be the first test in evaluating suspected hypothyroidism. Which condition is most likely with high fever, muscle rigidity, and elevated CK in a patient on antipsychotics? A. Serotonin syndrome. B. Malignant hyperthermia. C. Neuroleptic malignant syndrome. D. Sepsis. Answer, C. NMS is a life-threatening reaction to dopamine antagonists characterized by hyperthermia, rigidity, and rhabdomyolysis. Which ECG finding is characteristic of hypokalemia? A. Peaked T waves. B. Flattened T waves with U waves. C. ST elevation. D. PR shortening. Answer, B. Hypokalemia presents with flattened T waves, prominent U waves, and possible arrhythmias due to delayed repolarization. Which condition presents with proximal muscle weakness, heliotrope rash, and elevated CK? A. Myasthenia gravis. B. Polymyalgia rheumatica. C. MS. D. Dermatomyositis. Answer, D. Dermatomyositis features skin manifestations and muscle inflammation, especially proximal weakness and raised CK. What is the treatment of choice for acute adrenal crisis? A. Fludrocortisone. B. Hydrocortisone and 4 fluids. C. Levothyroxine. D. Desmopressin. Answer, B. Adrenal crisis is a medical emergency treated with stress-dose steroids like hydrocortisone and 4-fluid resuscitation. What type of hypersensitivity reaction is anaphylaxis? A. Type 1. B. Type 2. C. Type 3. D. Type 4. Answer, A. Anaphylaxis is an Ig-mediated type 1 hypersensitivity reaction with rapid onset and systemic involvement. What is the most common cause of lower GI bleeding in older adults? A. Colorectal cancer. B. Diverticulosis. C. Hemorrhoids. D. Angiodysplasia. Answer, B. Diverticulosis, especially in the sigmoid colon, is the leading cause of painless lower GI bleeding in the elderly. Which pediatric condition causes a current jelly stool? A. Pyloric stenosis. B. Hirschsprung disease. C. Intussusception. D. Meckel's diverticulum. Answer, C. Intussusception presents with intermittent abdominal pain and red current jelly stool due to bowel wall ischemia and sloughing. What is the most common cause of acute pancreatitis? A. Hyperlipidemia. B. Alcohol. C. Trauma. D. Gallstones. Answer, D. Gallstones and alcohol are top causes. Gallstones obstruct pancreatic ducts causing inflammation and enzyme activation. Which heart murmur increases with Valsalva? A. Aortic stenosis. B. Mitral regurgitation. C. Hypertrophic cardiomyopathy. D. Tricuspid regurgitation. Answer, C. HCM murmur intensifies with decreased preload, as seen during Valsalva, due to narrowed LV outflow tract. What electrolyte abnormality is most associated with torsades de pointes? A. Hypokalemia. B. Hypomagnesemia. C. Hypernatremia. D. Hypercalcemia. Answer, B. Hypomagnesemia prolongs the QT interval and can trigger torsades, a dangerous polymorphic VT. Which drug is contraindicated in patients with asthma and nasal polyps? A. Acetaminophen. B. Ibuprofen. C. Diphenhydramine. D. Loratadine. Answer, B. NSAIDs like ibuprofen can trigger bronchospasm in aspirin-exacerbated respiratory disease. Which childhood exanthem begins on the face and spreads downward? A. Roseola. B. Rubella. C. Measles. D. Fifth disease. Answer, C. Measles, rubeola, starts with Koplik spots, followed by a cephalocaudal spreading maculopapular rash. Which diabetes medication is contraindicated in heart failure? A. Metformin. B. Sitagliptin. C. Pioglitazone. D. Glipizide. Answer, C. Thiazolidinediones like pioglitazone cause fluid retention and are contraindicated in heart failure patients. Which diagnostic tool confirms giant cell arteritis? A. ESR. B. Temporal artery biopsy. C. CT head. D. ANA. Answer, B. Temporal artery biopsy is the gold standard for confirming vasculitis and inflammation in GCA. Which murmur is associated with a wide pulse pressure and bounding pulses? A. Aortic stenosis. B. Mitral stenosis. C. Aortic regurgitation. D. Mitral regurgitation. Answer, C. Aortic regurgitation leads to increased stroke volume and rapid diastolic runoff, creating wide pulse pressure. What is the first-line treatment for stable angina? A. Beta blocker. B. Digoxin. C. ACE inhibitor. D. CCB. Answer, A. Beta blockers reduce myocardial oxygen demand and are first line for symptom control in stable angina.